All right, here's another ongoing problem. Skin blemishes, they can be frustrating, sometimes unsightly, even downright embarrassing. But if you've suffered from skin issues, you're in really good company. And serious skin disorders are more than skin deep. They can actually pose overall health risks or even be a sign of a more serious problem. So let's get into this. Dr. Bruce Strober is a UConn Health dermatologist. He joins me this morning. Good morning to you.
Good morning.
All right, this topic is near and dear to my heart because I deal with eczema and a lot of people deal with inflammatory skin issues. Psoriasis being another big one. First of all, why is this such a common phenomenon?
Well, we don't know why severe skin disease is common because it's been around for a long time and most people have a mild condition. About 1 to 2 million people have severe psoriasis, and therefore you probably know someone who has someone in their family with severe psoriasis.
Well, even famous celebrities, Kim Kardashian is always very outspoken about her psoriasis. I mean, we see every bit of her, and she just came out and said, I've got psoriasis, and it probably, putting a sort of celeb name on that, it makes other people realize, hey, this can happen to anyone, and it really can, right?
Right. There are actually some famous athletes as well who've come out, and Phil Mickelson being a famous athlete with psoriatic arthritis. He wouldn't have psoriatic arthritis if he didn't have some degree of psoriasis.
Is that right? Okay, so what exactly is it? Like, what is the difference between psoriasis and eczema?
There's a large difference. They're both itchy skin rashes. Usually eczema is itchier. Usually it occurs earlier in life, people under the age of 5, whereas psoriasis occurs later in life. And dermatologists are well trained to distinguish between the two and how they look and how they present in patients. So
what can you do? I know that you sort of start small and then you work your way up as things start to fail. What is the first sort of line of defense that people can do? Because you can't prevent them, can you?
You cannot, because they're inborn.
Okay.
But you can lower the risk of them being severe. Simple activities like daily moisturizing of the skin. But then if you see a dermatologist, if it's not manageable, you could be prescribed topical medications that are only available through a prescription and that are applied to the affected areas of the body.
And of course, with any sort of steroid that you're applying topically or anything else, you don't want to do too much of it because it changes the condition of your skin. Correct. And then you don't want to sort of have to rely on it. And it goes up from there, right? Eventually inflammatory drugs like prednisone and that sort of thing.
Right. Ultimately, we have to use medications by mouth or by injection that block inflammation. Those medications carry risk too, so they need to be done under the guidance of a healthcare professional.
Is there any way that this eventually just goes away? Sort of as quickly as it comes, can it also just disappear? I'm still waiting.
In the case of psoriasis, it's not common. It's believed fewer than 5% of patients have a spontaneous remission, that it just goes away. With eczema, it's believed many children outgrow it, and the adults that carry eczema are the unlucky few.
Boy, I'll have to play the lottery because I won that one. All right, so you're also doing some clinical trials.
Correct. We specialize in investigations of new medicines to treat more severe cases of eczema, more severe cases of psoriasis.
And so if people want to contact you and perhaps become part of this or learn more about it or even just have you look at their situation, because it doesn't hurt to get more opinions probably.
Correct. You can always call the UConn Health Center Department of Dermatology. Keep in mind, many patients who call in are not severe enough to get into these studies.
Right, right. This is for severe cases, not a little eczema on your finger or something.
Correct, and usually they're adult patients only.
Okay, good to know. Thank you for coming in. Really appreciate the information.